السلام عليكم. معكم الدكتور وليد بيت المال من منصة اشرحلي. Welcome to this OET course. In today's video we will talk about OET in general. What is it? Why do we recommend that you choose OET? Who recognizes OET? The test overview, and we will talk in specific about this course and what you should expect to learn with us in these videos. Now, the occupational English test was developed to test healthcare professionals' English communication abilities. Like the IELTS, it is divided into 4 subtests. It will test your listening, reading, writing, and speaking. OET can be taken by healthcare professions in any of the following 12 professions, as you can see. So you must choose the type of exam that matches your profession. Now, how can you book the OET exam? It's very simple, very straightforward. You can go to their website, occupationalenglishtest.org. You create an account, and then you will be able to choose the time of the exam, the location, and the date. Now, there are 3 types of OET exams. There's the paper exam. There's the computer exam that you can do at a venue, or you can do the OET exam at home, right? So you have 3 options that you can choose from. Now, why do we recommend choosing the OET? Because it uses scenarios from healthcare sectors, so you will feel more confident on test day. That's what makes it easier to prepare than the IELTS, because all of the topics are related to healthcare professionals, so you will not find something very strange to most of the topics. Will be understandable by most of the candidates. That's why it is easier to prepare for healthcare professionals, and that's why we recommend it at this point. Now, who recognizes OET? Many countries are starting to recognize OET, including these countries and more. You can have more details on their website. OET is accepted by many organizations and councils. If you want to work as a doctor or a nurse or a dentist or any of the other professions, it is also accepted by many universities. If you want to continue your studies at any of these universities, the details are all available on the OET website, official website. Now, one point that you have to pay attention to is that some organizations and some universities do not accept the online version of the OET test. So before booking your test, you must make sure that the council that you are going to register in, or the university that you are going to study at, accept the type of OET exam that you are going to book. Okay. So if the university does not accept online OET exam, so you will not be able to study in it. If you do the OET online exam, you must do the paper OET exam. Now, let's talk about the OET test in general. Now, like we said, it is divided into 3 subtests: the listening, reading, writing, and speaking. It will take approximately 2 hours and 45 minutes. The listening part will take 40 minutes. You will have 42 questions. The reading will take 60 minutes, and also it will have 42 questions. The writing will have 45 minutes, and you will only do 1 task, not 2 tasks like the IELTS. The speaking will take approximately 20 minutes. to do, and you will do 2 role plays in the speaking. Now we will talk about each subtest in details in the upcoming videos. Now, how are the results reported in OET? Now, the desired score that doctors and dentists desire are grade B and higher in each subtest, which is equal to 350 and more, okay? Which is just like the IELTS score of 7 and higher. Some organizations and councils for the nurses accept C+ and more in the writing, but they require a B grade in the other subtests. So the common desired grade between most healthcare professionals in this test is going to be a grade B or higher. Now, what do we mean when we say that this candidate got grade B or got 7 in the IELTS or more? This means that you can communicate effectively with patients and healthcare professionals using appropriate register, tone, and lexes with only occasional inaccuracies and hesitations. And this will show that you have a good understanding in a range of clinical contexts. Now, if you don't have occasional inaccuracies, then you will be graded as grade A, and you will get in the IELTS 8 or more. So that's our goal. When we do the OET test, our goal is to get grade B or higher. Now let's talk about this course, but before we talk about this course, if I asked you, is the OET test a skill test or a knowledge test? You must know that it's a skill test, all right? It doesn't test your medical knowledge, right? It will test your ability to apply your language knowledge in the test, okay? Now, to pass this test, you must learn test-taking skills and practice these skills. Think of it as a driving license test. Now, you can read as long as you want about driving, but if you do not practice driving yourself, you will probably not pass your driving test. Okay, so it's the same idea here. You must have the knowledge first. Yes, the knowledge is important, very important, as we mentioned, but without practicing the test-taking skills, you will not be able to get the grade that you desire. So, when you start preparing for the OET test and start taking sample tests and mock tests, you can get the desired score from the beginning, which is good, or sometimes some candidates will have a lower score. And now we will have a gap between our actual score and the desired score. Now, to improve your score and to get to the desired score, you need to improve 2 things. You need to improve your test-taking skills, and sometimes you need to improve your language skills. So, depending on your strengths and weaknesses, you need to work on your weaknesses and improve your strengths. To improve your test-taking skills, you must familiarize yourself with test format. You must practice an efficient approach to completing the questions in time. You must also improve your language skills by improving your grammar, increasing your vocabulary, speaking, listening skills, and reading skills, depending on which part you are finding more difficult. So you need both of these to improve your score. You cannot just keep repeating. If you get a lower score than you want, For example, let's say you got 300 or 290, repeating the test over and over again will not increase your score dramatically. Instead, you must find out why you are getting this score and you must improve it. Okay, so if you need to improve your grammar, then you must work on your grammar. Repeating the test itself is not going to help you. If you need to work on your vocabulary, you must read more to improve your vocabulary, and so on. Right, so in this course, we will talk about each subtest. We will talk about the overview of the reading, listening, and speaking. We will talk about what to expect in each of them, how to approach, tips and strategies for each subtest, and we will have some samples to practice on. The writing will have more content. We will talk about an overview about the writing, the assessment criteria, the letter format, the strategies, extra tips to focus on, and mistakes to avoid, common mistakes to avoid. We will talk about some important grammar rules, which are very important for us when writing the letter, and we will have some samples to practice on. Thank you for watching this video, and see you in the upcoming videos.